There is nothing in the pain management world more exciting than spinal cord stimulation right now. This form of therapy has been around for almost 3 decades, yet it wasn't until the year 2016 that we came upon this thing called high-frequency spinal cord stimulation. It's been a game changer. A spinal cord stimulator is a small pacemaker-like device that's used primarily to treat people with chronic spine, back, and leg pain, but it's also used to treat chronic neck and arm or upper extremity pain. Most commonly, these are patients who have had prior surgery, oftentimes including multiple surgeries and multi-level fusion surgery, who have had very successful surgical procedures, and yet at the end of the procedure, they still suffer from intractable pain. This device is implanted inside. There are 2 small leads or wires that reside very close to the spinal cord, and the device utilizes a gentle electrical stimulation that helps to block pain signals as they travel up the pain pathways in the spinal cord to reach the brain. High-frequency spinal cord stimulation has been available in Europe for about 13 years. It was not available in the United States until the year 2016. I was privileged enough to be able to place the first 4 high-frequency spinal cord stimulator devices here in the state of Nebraska in June of 2016. I've completed over 300 implants of those devices since then. Perhaps the biggest advantage of spinal cord stimulation is this thing that we call a trial period or a trial phase. There are very few things in the medical profession where you get to do a test drive first. You can't practice spine surgery and then bring them back later for the real thing. Well, with spinal cord stimulation, we have the opportunity to place a couple of leads, and this is done right in our office, but we place the leads and we leave the device on the outside and allow people for 7 full days to experience the benefits of spinal cord stimulation without permanently implanting the device. And if all of us are in agreement that the trial was of significant benefit, not only in relieving pain, but in improving a patient's ability to function and their quality of life, then we make the decision to put the device in permanently. My favorite patient story is probably my first patient with high-frequency stimulation. An older gentleman with something called spinal stenosis, someone who, with the older devices, I never would have considered spinal cord stimulation with. Interestingly, his granddaughter was an orthopedic surgeon from the West Coast who called me on the phone and thanked me for what I had tried with her grandfather, but both of us recognized that everything that I had done up to that point was pretty much ineffective. She mentioned the possibility of considering this high-frequency stimulator device, and to make a long story short, ultimately we trialed the device, we implanted the device. So the last time I ran into this patient was in a restaurant the night prior to a Husker football game. And this older gentleman who had difficulty really walking more than 10 feet or so was marching around the restaurant playing his recorder, playing the Husker fight song. His wife happened to see me and came over and sat down at the table and expressed her gratitude in regards to the improvement of quality of life that he had experienced.